Tammy Marsh. I'm a sergeant with East Hempfield Township Police Department. On March 3rd of 2008, I was in a motor vehicle accident where I was rear-ended. I had neck and back pain at that time. I'd gone through some physical therapy for both the neck and the back, at which time it didn't get any better. So I was referred to Dr. Argires' office by my family physician, and I also had known Dr. Argires prior to the car accident, so it was a logical choice. In 2004, with Dr. James Argires, he took great care of me. Wonderful man, wonderful disposition, made sure that all the tests were done to see what was actually wrong, and got me to a level that I could function again at work. He's a great guy. Since I had such a great experience with Dr. James Argires, and my husband actually had seen Dr. Perry Argires, it was a logical choice for me to go with Dr. Perry Argires for the new injury to my back. Well, my family physician ran an MRI on my back when non-invasive type things were not helping at all. And the MRI showed that I had a herniated disc in my lower back. Dr. Argires got me in right away to be seen for an evaluation and to take a look at the MRI. First, Dr. Argires wanted to begin with non-invasive procedures, techniques, and I was referred to Dr. Simons for cortisone shots, which then went into facet blocks and some other non-invasive type procedures. That went on for a little while. I still had the pain in my lower back and into my right hip. And at that point, Dr. Argires sat down with me and went over all of the choices I had in terms of surgical options to try to get my back to a point where I would be comfortable again. Dr. Argires spoke to me about two options for surgery. One was a fusion, and one was an artificial disc replacement. The disc that I was having trouble with was L5, S1, which is the lowest one in your lumbar. And we went over all the options, and he felt very strongly, and I have complete faith in him, that the artificial disc replacement would allow me to still be mobile and give me the most benefits long term. I had a surgery late in the afternoon on April 30th of '09. After I got out of surgery, I immediately knew my hip felt better. The pain going down my leg into my foot was gone. My back felt better. At that point, once I got to the room and went through recovery, I was up and walking that night within probably 4 to 5 hours after surgery. So I could clearly walk again without that excruciating pain. They did their PT and their occupational and checked everything out, and I did very well. The surgery did not cause me a great deal of discomfort. In fact, I had far less discomfort when I left the hospital than when I went in the hospital. I was out the next day within 24 hours. Dr. Argires he's a godsend. He is the greatest.